Europe. I think we have people from Sweden, from France, from many places, several European countries. And there are many more watching online, which is also to inform you that this event will be live streamed. And that also means that those who can't join us physically can watch online. And afterwards, there will be a link on the website of the Alliance of Global Health so that everyone can take the points from this day. Let me just quickly go through today's program. In a little bit, we'll have opening remarks by Søren Brostrøm, who's been flying in from Geneva, followed by a video greeting by global health giant Larry Summers on the findings of the third Lancet Commission, which is a big inspiration for the expert group and also for the Alliance. Then we'll have the presentation by the members of the expert group, and we'll take a deep dive into these 19 recommendations, followed by a panel discussions with politicians, with experts, including a remark from the ambassador of Rwanda that we're very pleased can join us. We'll have a video greeting from the Ethiopian Ministry of Health, and then closing remarks from the Danish Ministry of Foreign Affairs by Ole Tonke. And then there'll be a short wrap-up and a reception afterwards. And with that, and one thing I just quickly want to say is, on your chairs, I think all of you have had recommendations, of course, and then a poem by Tove Ditlevsen, a Danish poet, to remind you that we can do research, we can write reports, we can do recommendations, but we can also, as artists, express how global health is a very personal experience and how our health is the basis for the way we function, and also how our health depends on the health of everybody else. And I will come back to that point with a little personal story later on. With that, I would love to give the word to Søren Brostrøm to come with the opening remarks. Søren, if you want to come up on the stage. Let me go back here. And I can hand you this, and this should be on. And Søren Brostrøm is now a senior advisor to the World Health Organization's Director General, where you are responsible for organizational transformation and change in WHO. Sounds like quite a job.
Sounds very boring, huh? But it's actually a lot of fun.
I think it sounds like a big mouthful.
My new job is trying to reform and change a huge bureaucratic 76-year-old UN organization.
And I just want to also emphasize that your previous decision was as a director of Danish Health Authority, which is also why journalists like me have had Søren for interviews a lot during the COVID pandemic. But thank you
and
so
before
much.
that, before I became a government bureaucrat, I was actually a clinician for almost 20 years. Exactly. Obstetrician and gynecology is my background. Anyway, thank you very much, Stine, and thank you very much also for the Danish Alliance for Global Health for inviting me. And congratulations to the expert group on your excellent recommendations. I've been following the work closely, and I think it's extremely important to have your report and your recommendations here. So I've been asked just very briefly to speak about why is global health important for Denmark. We might break that question down to what is global health? Why is global health important? Why is global health important for Denmark? Or maybe you might also flip the question around and ask, why is Denmark important for global health? That's probably the real question, and also the real question that recommendations is trying to address. So by global health, traditionally, we mean, that's sort of public health on the global scale. That's basically about the health of populations, of people all around the globe, and that's how we have traditionally approached it. And I'm sorry to be the bearer of bad news here today, but it does not look very good for global health. Few positives on the horizon, but looking at the indicators, it is certainly not going the right way. So we really need to focus more on global health. We are also increasingly seeing new emerging threats. We are also recognizing new emerging threats, among them the health effects of man-made climate change. That was not really on our radar just going back 5, 6, 7 years ago before the pandemic. We are now increasingly realizing what we should have recognized earlier, but never late than never, that there are many, many health effects of man-made climate changing. Effects on water, nutrition, food, sanitation, new emerging diseases or spread of known diseases, vector-borne diseases such as malaria and dengue certainly will be a reality on the Northern Hemisphere, etc. Also many consequences for healthcare systems, direct and indirect, of man-made climate changes. Hospitals, clinics, healthcare systems being overburdened by new diseases caused by climate change, but also direct effects on healthcare facilities that are flooded or losing water or electricity, etc. So that is certainly one of the new threats that have emerged. We're also seeing constant increasing wars, conflicts, crises around the world, even here in Europe. Ongoing war now very close to our borders, with unprecedented migrations also because of these wars, crises, fragile states, etc. And this always has health effects. And it's almost the most vulnerable: women, children, the old, the sick, who are affected most by these crises. Unprecedented migration around the world, even here in the European region. So many new challenges on top of the challenges we already had in global health. Many countries, healthcare systems around the world, have still not recovered from the COVID-19 pandemic. Many countries did not do as well as we did here in Denmark during the COVID-19 pandemic, and they have certainly not recovered as well as we have had in Denmark with a strong healthcare system, where we are more or less beyond the post-pandemic challenges. Many countries haven't. They're still lagging behind. And that, again, came on top of the challenges we already had before the pandemic, which is that we're not making progress on the health-related SDGs. You can always recall we made the SDGs. We are more than halfway to the SDG goal of 2030. Our projections in the World Health Organization is that optimistically maybe only 15% are on track to reach the goal in 2030. These are heavy things. I mean, just to mention a couple of indicators that are not on track as we would want them to be. Maternal mortality. We are not making progress on maternal mortality now, as we should be. Maternal mortality is basically a woman dying from pregnancy or childbirth. And that really hurts me as an obstetrician, because I know how fairly easy it is for a healthcare system to prevent and treat and prevent maternal mortality, basically having a skilled healthcare professional for the women, taking care of the woman with very simple technology. We're not talking about rocket science or expensive stuff. We are not making progress. We are not making progress for the first time in 3 decades. We are not making progress on childhood immunization. Very much also the post-pandemic breakdown of many healthcare systems. We're not providing. It's not that we don't have the vaccines, but we are not getting them provided to the kids. So looking at what we call zero-dose kids, which is basically children who do not get the basic immunization in the first year of life, our estimate is maybe around 15, maybe as high as 20 million kids a year who do not get that. I mean, these are very, very key, strong health determinants that should be fairly easy to fix, and we were on the right track, but now we're not. So there's a huge challenge here, and of course Denmark should play a role. Denmark has a huge responsibility. It's a moral imperative for Denmark with a strong tradition in health development. We're also very, very strong economy, also in large part because of a strong life science sector in this society. Again, adding to the moral imperative. We also have a strong healthcare system. We have strong healthcare knowledge. We actually have technology, science, etc., that we can contribute and that we should contribute. It's also in Danish interest to fix global health. Self-interest, if you will. It's also about safety. I mean, we realized that very much with COVID-19. I just mentioned some of the many calamities of migration, pandemics, climate-related challenges, new pandemic emerging, etc. These are all cross-border health threats that will also affect and threaten Denmark and our sustainability in our society. So as we realized during the COVID-19 pandemic, which was really a very, very global thing, spreading very fast, and with Europe as the big epicenter after the outbreak in Asia. We realized that nobody is safe until all is safe. Global health. There are many challenges to fix this. Multilateralism is being challenged increasingly, and with new political changes, I mean, recently the US election, of course, increasing challenges multilateralism, and we see that breakdown happening also in the sphere of global health. But it's even more than that. It's also an increasingly constrained funding situation for global health around the world. Many large donor country economies not performing well in global health. Multilateralism being challenged, but it's also even more than that. It's also rights being challenged again, reproductive rights, gender rights, women's rights, but it's even more than that. It's also science, evidence, vaccines being challenged in a scale that we haven't seen before. So huge challenges. Again, Denmark can play a role, and Denmark should play a role, and I think especially in this situation that I'm just describing with multilateralism being challenged, etc., a small but powerful, potentially powerful country such as Denmark can play a strong role. And an even stronger imperative next year, where Denmark will be a member of the Security Council. Second half of next year, Denmark will have the European Union presidency. So that all adds to the imperative of a stronger role for Denmark in global health. And I think in this context that the recommendations from the expert group are extremely timely. So thank you very much for that. And
thank you so
Stine.
much. Thank you. Thank you, Søren. And before we have the presentation of the recommendations, we'll have a short video greeting with findings from the Third Lancet Commission on Investing in Health from Larry Summers, who is, of course, university professor at Harvard University, but also have had a lot of other roles and been very involved in global health for many, many years.
I'm delighted to be with you. I only wish I could be with you in person. I have to say, as an American, I'm a bit humbled to be talking to any Danish global health group. As best I can tell, Denmark has substantially more favorable health statistics than the United States. Denmark is a hero in terms of meeting assistance benchmarks, 0.7% of GDP, that puts some of the rest of us to shame. And Denmark has been the incubator of semaglutides, which might be the most important pharmaceutical innovation of the last quarter century. Nonetheless, it's my privilege to be talking about a report that I was recently involved in leading. The fundamental mission or statement of that report is a case for optimism in global health. We note that the child mortality rate has fallen by half in the last generation. We note that it is reasonable on the basis of our earlier work to aspire in the broadest sense to grand convergence. 250 years ago, mortality rates were kind of the same everywhere around the world, and they were really high. And now there's a prospect in our lifetimes for there to be convergence around much lower mortality rates. The current Lancet Commission report focuses on a metric that has perhaps gotten less attention than it should: overall premature mortality, defined as mortality prior to the age of 70. We set a clear and strong goal, 50 by 50, a reduction of 50% in these mortality rates prior to 2050. What are critical elements of the strategy? We highlight the importance of pandemic preparation. Because of the profound unevenness of the pandemic health burden, with almost no lives lost in most years and extraordinary levels of mortality in a limited number of years, the risks of global pandemic are probably increasing, with a at least even chance of a substantial pandemic in the same general range as COVID taking place, certainly within the next generation. We believe that the world is inadequately preparing for that, and doing better preparation has to be a crucial global health priority. We highlight the assistance of global health assistance. This is an area where Denmark has, given its scale, done as much or more than could be reasonably expected. As you think about and strategize for your future efforts, I would just highlight 2 points. The need for focus on specific and key conditions in the poorest countries, and the need to be attentive to global externalities and global public goods, the importance of supporting the development and dissemination of new therapies where there's a substantial fixed cost of development, but low marginal cost, so that everyone benefits from the effort of anyone else. And I hope those aspects can shape your strategy, even as I confidently expect that Denmark will be a world pace setter in the future, as it has been in the past.
Serious one as well, and one with great expectations for Denmark. And with those words from Larry Summers, I would love to get 3 members of the expert group to come up on the stage. Anna and Angela and Stephen. And I will just introduce you. So Stephen Jensen, Senior Researcher at the Danish Institute for Human Rights. Angela Chang, who is an Associate Professor at the University of Southern Denmark and a member of the Third Lancet Commission on Investing in Health. And Anna Frelsen, who is the CEO of Maternity Foundation. And Anna, I believe you will start by making, and let me just do this. And then I'll get
Yes, thank you. Thank you so much. So I don't think there's any doubt after we have listened to Søren's presentation that there is a sense of urgency. I also recall when you were speaking with us in the expert panel, you talked about the perfect storm in global health. I think that's also very clear that that's what's happening. At the same time, Larry Summers, he also talked about a case of optimism, building on the recommendations from the report, the Lancet Commission's report. Optimism around being able to halve premature deaths by 2050. And it's in this intersection of urgency and optimism that the expert group have come together and worked to develop some concrete recommendations in terms of the potential role that Denmark can and should play in global health. We have worked as an expert group, 8 members in total. Most of us are here today, with the exception of Justice. He is listening in live from Ghana. The expert group has been put together by the Alliance for Global Health, with the main criteria of having a wide representation from academia, multilateral organizations, as well as civil society. In the group, we've had medical practitioners, researchers, advocates, and leaders from within human rights and the global health sphere. And to make sure that we balanced a strong Danish representation, we also had 2 colleagues with an outside perspective. We had a colleague with Tobias from Sweden and Justice from Ghana. So, and we are here, the 3 of us, to represent the recommendations today. In terms of sort of coming up with these fairly concrete recommendations. We've gone through, I would say, a fairly intense, but also really good process. We did not have a lot of time. I think it feels like we almost met every week. And it's been a lot of discussion, a lot of hypothesis, and still I would say there has been in general consensus about what is really important here. The work, a deep dive on the important role of multilaterals. We had a deep dive on trends in innovation, new partnership models, and innovative financing. We had a deep dive on the needs of including low-income countries and communities, and with a specific emphasis on the importance of localization. And then we had a deep dive on Danish global health in a Nordic context. So what is Denmark's role in the Nordics in terms of global health? And here we looked carefully at the recommendations from the recently launched report from Norway. And last but not least, we spent quite a bit of time on looking into Sweden and what Sweden have done historically and what we could learn in Denmark from Sweden, but also how maybe we could strengthen the cross-cutting collaboration. Between each deep dive, there has been consolidated summaries, and there's also been pre-reads prepared by our strong secretariat at the Alliance and the partners at AIDS-fonden and Sex and Samfund. So it's not only been a lot of talk, there's actually also been some facts and some evidence that we've been able to lean up against. So this whole process has led to what, at least personally, I feel is still fairly short and concise, a total of 19 specific recommendations that then has been grouped into 4 overall groups or themes. And I would now love to give the word to first to you, Angela, to walk us through the first one.
Thank you. So I will lead with the first set of the recommendations. And just to know that the things that we have on the slides are a shortened version of the recommendations. So the details you can find in the page that you have, everyone. So the first set of recommendations is that Denmark must invest more in global health. The Lancet Commission has made a strong case that investing in health is an investment, right? It's an investment. It is not a cost. The return on investing in health is high in terms of human welfare, economic development, and of course leads to many other things as well. Denmark has historically been a front runner in global health. As Larry Summers mentioned, Denmark is one of the only 5 countries to have met the 0.7% of GNI, the national income, towards official development assistance, ODA. However, in recent decades, Denmark's development priorities have shifted away from global health, more towards other priorities such as migration, climate change, humanitarian aid, leading global health to drop down in its priorities. And so one of the key expert group recommendations is that Denmark bring back global health as a key development priority for solidarity and security reasons. Søren made the case very well. You mentioned self-interest. It all starts with S, so that's how I remember it. Security, solidarity. So I'm going to go with solidarity first. As Søren mentioned very well, the recent success of the pharmaceutical industry that addresses the global burden of diabetes, obesity, cardiometabolic syndromes, has made Denmark a very strong economically in growth. And it creates an economic opportunity to reinvest an appropriate proportion of that gain to addressing the global health burden in other countries, addressing the very challenges that underpins its prosperity. Furthermore, in times of crises, as Søren mentioned, and the changing of the global health leadership landscape, it is important for countries like Denmark that places emphasis on human rights, on importance of reducing health inequality to step up and set a normative standard on how we want other countries to lead, to behave. And this is especially the case of sexual and reproductive health and rights, as Stephen will elaborate a bit more later. Now, on the security front, Søren, of course, you mentioned all very well. So foreign policies, Denmark's foreign policy places a lot of attention to stability, regional stability. And by investing in health systems leads to more stable economies and democracies all over the world, and hence security globally and also for Denmark. And as Larry mentioned, the pandemic risks are high. So the Lancet Commission, we estimate a 25% chance of another COVID-like magnitude pandemic happening in the next decade or so, and a 50% chance of something like this happening before 2050. So investing in health, investing in pandemic preparedness all over the world will also be beneficial to Denmark. So with solidarity and security reasons in mind, the expert group recommends the strengthening and investments in global health, replacing, kind of bringing back global health as a priority in development priorities, and consistently allocate more than 0.7% of GNI to ODA to ensure increased global health funding does not negatively impact other development priorities that Denmark has. And then within the ODA portfolio, so that was the ODA, so bringing the pie a bit bigger, not just staying at 0.7, but bringing it bigger. And then within this pie, allocating 0.2% or more of the GNI to the least developed countries. And this is in line with the historical Danish level that it has been doing, as well as the UN targets, and also in line with what the Lancet Commission on Investing in Health recommends to reflect Denmark's core belief in addressing inequalities worldwide.
Okay, so I will cover the next one, which we have labeled Denmark should assume global leadership in health. We're not naively trying to restore some allegedly glorious past of Denmark as a leader in global health. But in the expert group, we have been keenly aware of important legacies that Denmark carries with it into present-day realities. And we have wanted to build on these legacies. And this is one of the reasons why sexual and reproductive health and rights are featured so strongly up front in our recommendations. Because Denmark can here build on existing strengths because this has remained a Danish priority. It is no doubt an area that will require increased attention and vigilance with what we can expect lies ahead in 2025. And we believe this calls for renewed global leadership and renewed efforts to strengthen cross-regional and global alliances, efforts to highlight when and where possible what some call the UN of the many, against the opposition that will be faced on SRHR. We also recommend that this global leadership requires advocating even stronger for the central role of sexual and reproductive health and rights in realizing the SDGs, but also in advocating from now on for their importance for the post-2030 development framework for which preparation must soon begin. SRHR also highlights the case we make for Denmark anchoring its global health investments firmly in human rights. Now, our recommendation 6 speaks to the Nordic dimension that Anna also highlighted, and it indicates how much emphasis we have placed on this in our expert group, including considering Swedish and Norwegian experiences directly in our discussion. We have taken clear note of the fact that combined, the Nordic countries are the 5th largest donor of overseas development aid. And we have therefore recommended that Denmark should lead the way in shaping what we call, quote, a new generation of political leadership in global health. We fully acknowledge existing close cooperation among the Nordics. Indeed, many of us in the expert group have witnessed this up close in numerous occasions around the world. We do, however, believe that this can be advanced further and that the time is right for this. We had considered calling for the development of a Nordic global health strategy, and we had also considered calling for global health becoming an agenda item for regular meetings of Nordic heads of government to link high priority with the highest level of political leadership, like a Nordic version of the way HIV, TB, and malaria were addressed during the 2000s very regularly at G7 or G8 meetings. Instead of being that prescriptive or directive for our governments, we have decided to call for aligning global health strategies among the Nordics and let the governments themselves work out the right modalities for how we achieve this. We are convinced that the Nordics can do more to step up a more coordinated global leadership role together, which is urgently needed. We call also on Denmark to play an even stronger leadership role in reform processes to promote accountable, efficient governance within global health multilaterals. And we express our support to the so-called Lusaka agenda as a relevant framework that has defined a way forward, not just for transparency, greater transparency and accountability, but also for another aspect that has been important for us to highlight. Namely, that the discussion on global health is not always about more spending. It is equally important to emphasize how to achieve better spending with the existing resources and global health initiatives that we have. It will be known to everyone here that Denmark next month takes up its non-permanent seat in the UN Security Council. January 25 also marks the 25th anniversary of when a health issue for the first time was recognized in the history of the UN as an international security concern by the UN Security Council. The focus then was on the HIV/AIDS pandemic. In our recommendations, we have a focus on Denmark's membership of the UN Security Council and what can be done on health-related issues here. Refer to that in our recommendations on sexual reproductive health and rights. But we also have two other topics where this link is directly relevant. We have a recommendation with a call for Denmark to use its seat on the Security Council to put an emphasis on the protection of health personnel, patients, and infrastructure in conflict zones, so in the humanitarian part of the work of the UN. And the second of these topics relate to climate and health, and Søren already laid out a number of the challenges there. We recommend that Denmark leverage its leadership position in various global climate forums to take the lead in ensuring that climate funding is increasingly geared towards addressing climate-related health challenges. And then back to you, Angela.
Okay. The third set of recommendations is about Denmark should transition from being a donor to a partner in health. So in our expert group, we have Professor Justice Nonvignon, who's online from University of Ghana. And throughout his career, he has worked with many different donor organizations. And he noted that Denmark and Danish aid have a good reputation of being respectful of country partners and country priorities. My own experience working with the NIDA grants has also made me realize that they place a specific emphasis on capacity building in local universities, and it's much appreciated by partners. And this is not common in other donor organizations, in case you didn't know. And so this is something that Denmark should be proud of. And so this section of the recommendation is about not only what we bring to the table, but how we should conduct ourselves at the table. The expert group recommends centering the Danish global health partnerships around country-driven and locally led priorities to mutually benefit collaborations. It's not only the right thing to do, it is the most effective way to achieve results. Denmark already has a good reputation to build on, and there's much also to do to be a true partner. The expert group also recommends supporting regional bodies such as the African Union, African Center for Disease Control Prevention, and their regional priorities and initiatives. And as a concrete example, the concept of the new African Public Health Order is a promising framework that we can build our collaborations around. We also recommend promoting sustainable financing and financial resilience in low-income countries to allow governments to pay for their own health services. So making sure that we are not crowding out domestic funding and making sure that governments themselves are paying for key commodities, and we are playing a supporting role in trying to crowd in additional resources to help support countries. Now, beyond financing, what else can Denmark bring to the table? The expert group recommends that the government or the Danish aid should not restrict our involvement in just public sector involvement, but rather thinking about the broader context that Denmark provides. Denmark has really strong expertise in the private sector, a lot of it that touches directly on the health of, globally, not just the life sciences industry, as you can imagine, but also the food, agricultural systems, the green energy sector as well. And so the expert group recommends that the Danish government think innovatively about coordinating efforts with private sector partners to think of strategic ways of investing in health and to address of course, other burdens such as non-communicable diseases, antimicrobial resistance, and climate change and health. And specifically on life sciences, the expert group recommends making its expertise available to support global access to affordable health products worldwide, including strengthening in-country and regional R&D manufacturing capacities, promoting peer-to-peer partnerships and technology transfers.
So for the final category of recommendations, it's fair to say that as an international policy area, there's little doubt that global health has been in a state of flux since COVID-19 hit us 5 years ago. And as we enter 2015, this state of flux will continue for global health and will intensify across areas such as support for multilateralism, international funding for health, policy collaboration, and the normative strongholds that we build on. So while we need to rethink our approaches to global health, we also need to consider how we protect gains made. And our final 4 recommendations speak to both of these aspects. We call for the need to prioritize global health in the next Danish Strategy for Development Cooperation, which will be presented in 2025. This is an important starting point. For Denmark to step up further, we recommend the development of a dedicated global health strategy to strengthen the coordination of Danish global health efforts across policy areas such as development, security, foreign policy, and health. And we also recommend the appointment of a global health ambassador to coordinate health efforts and promote collaboration across relevant Danish authorities, academia, civil society, private sector, and more. And while this is an approach that has been applied in both Norway and Sweden, we realize this is not a model that Denmark has chosen in the past. But we believe the time has come for a Danish global health ambassador that can leverage and increase synergies and help ensure the sustainability of Denmark's global health investments. And finally, some of you will be aware that the human resources for health has been a long-standing area of concern in international development discourse. Our final recommendation might fit the label of human resources for global health. And in order to fully leverage the impact of Danish investments and position Denmark firmly as a leader in global health, we call for the strengthening of the talent pipeline for new global health champions and increase civil servant and technical capacity within global health. There's little doubt that increased prioritization and investment in global health can be a pathway to greater influence, but there's also a strong likelihood that increased presence in important international policy fora and processes can lead to greater influence. And we believe that also on this dimension, Denmark can step up and achieve more for global health through a stronger re-engagement. Thank you.
Thank you so much. Let me see. Oh, it's on. And while we do a little change of guards to have the expert group come down, and I would like for Søren and Majbrit and Flemming to come up, I'll just quickly tell a little story. Because on your chairs, there is this poem by Tove Ditlevsen about a game of tag. And if you take a look at that poem, chosen by the Alliance of Global Health, it reminds us, I think, of 2 things. I mean, it tells the story of innocent children who are playing tag and how that actually becomes a very, a mark of death and illness. And she ends the poem saying, "Now play the children who will fall tomorrow to the hand that mercilessness points, you're it." The poem reminds me that 1, health surpasses everything. If we're ill, we can't function. And 2, health is interconnected. And I will just do a very brief story about that, and I'm sure we all have personal stories that, implore us how this is about recommendations and research, but also about our personal experiences, because that's where we really are called to action, I think. I had a powerful lesson when I was in Sierra Leone, covering different stories. I was visiting a gold mine. My car broke down in a small village, and I bonded with this little girl who was very playful and very nice. Her mom tried to teach me how to braid her hair. I was not very good at that. I cleaned a scar on her arm. I drove on. Later on, I traveled to East and West Africa with actually the former Danish Minister of Development, Mogens Jensen, met with a lot of different journalists and high-level people, then went back to Denmark. This was in the spring of 2014. Little did I know, little did the little girl know, that Ebola had just crossed the border from Guinea into Sierra Leone. When I returned to cold and rainy Denmark, the news broke that Ebola had broken out. And I realized that I could have been at risk. I realized I went through, like in the poem, all the people I touched, all the people I had shaken the hand with, shared a meal with, that because I'm a loving mother and I love my husband, I'd given them hugs when I came back, and that could have exposed my children and my husband to illness and potentially death. At that time, we didn't know that much about Ebola. I didn't know that she would have had to be really ill for her to give me the disease. Nothing happened. I wasn't ill. The girl survived. I went back to the village. Her parents sadly didn't. She was taken in by another family. Just a very short experience that for me gave me a very strong personal feeling of the level of importance of not only my health, but global health. And I'm sure that all of you have stories like this that really tells us why we are here today and have these recommendations. And now we would like to have reflections and discussions about the main findings by the expert group. So now we have up here Flemming Møller Mortensen, who is a member of parliament for the Social Democrats and a spokesperson on foreign affairs and development. And you are a former minister of development affairs. And then we have Maj-Britt Berlau, who is the general secretary of the Danish Family Planning Association, and who is, of course, part of the Alliance who commissioned this report, and Søren Brostrøm of WHO, who I already presented. I would love to start by doing a brief round and ask you all what your major takeaways are from the recommendation and the report. And if I could start with you, Flemming.
Thank you very much, and thank you for inviting, and thank you very much for making the recommendations. And the best for me as a politician is that we have this very, very big engagement in global health. We have so many partners, we have so many experienced partners that share together and try to come up with very concrete recommendations to the political level here in Denmark. And I think that it's very, very timely, because as mentioned, in a few months we will sit together, all parties in Denmark, and try to make a new development strategy. And of course, also here we are full of all the experiences that we all got during the pandemic. And I think the world has changed since we made our last strategy. So I hope that there will be a very big support politically for the new strategy, and personally and from the Social Democratic Party, we are very engaged and prioritizing global health.
Wonderful. Maj-Britt?
Thank you. And first, on behalf of the strategic partners, our strong friends in the AIDS Foundation and DFPA, Sex and Samfund Denmark, we would like to thank the expert group for such a brilliant work. You have been working very strong and for a lot of hours, and it is very strong piece of work. We are now can go and work together and go forward to make sure that Denmark can reinvest and take a strong position, continuous going forward on global health. Our takeaway is, of course, a strong focus on SRHR. In the recommendation, it is needed. And I think one of the very strong points I would like to stress is that SRHR is a health issue. It is not a moral belief, or it is not ideology. It is a health issue, and it has to be addressed as a health issue, and it also has to be addressed as a rights issue. And I think the recommendation reflects that very strongly. And if we talk about global health, SRHR is a very important part. Without that, there is no global health. So thank you for the strong recommendation. I think that is should be my opening remark.
Søren, your main takeaway?
If just highlight one thing from the expert group, I think they're making a very, very strong case for why Denmark should invest more in global health and why it's our obligation, why we can and should do it. Not that Denmark is not doing well. I mean, as also highlighted by the expert group, we are one of the very few countries who are actually at the 0.7% ODA. But why not strive for 1% and lead the pack? And also, no matter what the level of the ODA, that a higher proportion of that ODA should go to the least developed countries, and that a higher proportion of that should go to global health. I think that they're making a very, very strong case for that investment. And also, I like calling it an investment and not a funding. The Nordic countries have traditionally been very strong in this, led by Norway, which is completely ahead of the pack in investing in global health. But what we are seeing recent years is that all the Nordic countries are changing priorities. And very much because of what is happening in Europe and with the war in Ukraine, and of course also Sweden and Finland joining NATO, and all the Nordic countries ramping up on military and security, which is all valid. I'm not saying that's not important, but we do see that is detracting from investing in the least developed, and then some of the ODA's challenge to Ukraine, which again is very valid. But maybe, again, could we make the case for not taking away one for the other, but actually increasing the ambition and doing it jointly as a Nordic group? And of course, again, I mean, it would be wonderful if Denmark could take the lead and then getting the other Nordic countries to join. Why not?
Flemming, do you have a comment on that?
I fully agree that we have very, very good opportunities coordinating better between the Nordic countries. And I really feel also from the time when I was Minister also for the Nordic cooperation that there's a will to do it. But of course, we are confused and we are scared about the war between Russia and Ukraine, and we have to win that war. So that's the reason why prioritization is very, very tough. And I recognize that your recommendations here, they are targeted, and you want us to use more money for ODA, but I don't think I can't believe that we will be able to do that during the next years, because we have to protect our own security. And all what happens also with the new president in the US, I think we need all money for protection and security. But I will fight for, of course, that we will still have the 0.7% of the GNI for ODA. And we have seen recently what happens with a change of government in Sweden. We have seen the change in UK. We have seen the change in the Netherlands. So believe that we have to fight, but I believe that Denmark will still stay there. It's a signature for Danish Development Corporation that we are among the countries delivering what is asked for from the UN. And I think now it's only 4 countries being in the group. So that was what I picked up when I saw your recommendations first. I said, yes, I believe in a lot of these ways of making cooperation and making prioritizations, and also focus on the multilateral, because we know exact from the Danish side how important it is to be very strong in our multilateral organizations cooperation, because we were very much focusing on the Sahel area in Africa, and we have seen how difficult it has become. So we need security for all the development people, and the assistance from the global system. So I think it's a tough time. But if we can stay on 0.7 and we can take a leadership. I believe you, sir, and we are able to do that among the Nordic countries. Then I will be very happy, and that's a goal for me.
One important point that Angela made was to actually tie the security debate that we're talking about, like it's competing into doing this investment. So I guess that's also an important point from the expert group, that investing in global health is also about security. Maj-Britt?
Agreed on that. I think it's true, Fleming. It is a tough time. On SRHR, we are looking in a global gag rule from the US, setting an action in January, which will defund all organizations working with abortion, promoting abortion. It will lead to more young women dying from pregnancy, from giving birth. It will lead to a collapse of sexual health from clinics not being able to operate, and making sure that there are services access for people who actually need it. And it will increase STDs, it will increase the mortality rates. Also, we see not only the gag rule enact, but we see also that there are, on a global level, a strong pushback on the rights to your own body, to your own sexuality. And it is an attack on human rights. It's attack on the health issues. And I think that is so important that Denmark continuing being a champion on a global level on these issues. We actually can do a difference, both Denmark within ourselves, but also together with the Nordic countries. And the civil society, because something I think that is a very strong point from also the expert group, that the Danish government has prioritized to be strong leader within civil society in the partner country. And we need to continuing that work, because these to making sure that sexual and reproductive health and rights, there are access for it, and there are backing up on the rights. That is important, that the civil society it grows within that in the country, within themselves, and Denmark has a strong position there. So this is a call to making sure that we keep on being champions on these issues, because it do make a difference.
Chang?
Yeah, just one small comment also on the funding, on the investment in global health. It's not only about the quantity of the money, it's also about the quality of the funding. So even though it stays at 0.7% of ODA, which is fine, it's also about how is that funding delivered. And I think also the expert group is highlighting Denmark has actually a proud tradition for the way we fund. Flexible, sustainable funding, capacity building, etc. Not too earmarked, etc. That's extremely important. And Denmark has a wonderful track record here, and we can maintain that strength position even in prioritizing resources. And that is also what is driven by the Lusaka agenda and many other reform agendas in the multilateral sphere, because that earmarked non-flexible funding tends to very silo the approach to global health, etc. So I think Denmark can play a role in that.
Fleming, are there any of these 19 recommendations that you think already at this stage you can take with you now that you and other politicians are looking at developing this new development strategy for Denmark?
Yes, indeed, a lot of them. I will take them with me, and I think also it's also a matter of continuity, because we are on a good track. Also, what you said, Maj-Britt, when it comes to marginalized groups, SRSR, and inequality, we are fighting for girls' and women's rights. We will stay there. There will be no doubt, in my mind, that parties in Denmark will be there, and. So there's a lot of very good things, and I think the best thing of your recommendations is now, as I said, it's very, very timely, and they are very concrete. And just a comment to you, Søren, when it comes to funding. Yes, one thing is the ODA from Denmark. Another thing is all the philanthropic foundations and private investments. We have put up very, very good systems for accumulating funding here. And I think that's also something where countries around us, also among the Nordic countries, they think, oh, could we just do like in Denmark? But I felt when I was a minister that private companies and philanthropic foundations, they were coming up saying, how can we do together? That is really, it's crucial, and it's amazing that that's the way it is. And we have to focus, for me, for delivering the right quality to the right people, we have to focus on capacity. The private healthcare sector is really a matter to me. So capacity, but all capacities, also skills and also continuity. And that's the reason why I say that I would better do the half 100% than the whole 50%. I think that has to be a line of the Danish way of making our investments, because this is investments, yes.
Maj-Britt, you are part of the Alliance who commissioned this report. I would like to ask you about the big why, because we have a lot of answers now actually in the report. There are a lot of things we know work. There are a lot of things that we know we can do to save lives. Why right now?
Because we, both at a global level, see changes. We have been discussing some of them: security, migration, climate changes, and it forces us to address global health with a renewed perspective. So, for example, on SRHR, it's not only SRHR isolated; it's also SRHR combined with with climate changes, with migration, with conflict situation. So we have to see it in a more intersectional perspective, actually. And that is some of the reasons why the big why is there, but also because we see a pushback. We see a huge pushback of some of those issues where other political issues are taking precedence over global health. And on especially SRHR, we see the pushback, as I addressed before. And it is not just a small pushback, it's a very crucial pushback. And those of us who believe that these are crucial human rights and global health issues, we need to address this at a multilateral part of the world, but also with our friends in the US government, checking on the challenges, saying that this is not a moral or ideological or religious belief, it is rights and health issues. So these are some of the reasons why we are commissioning this expert report, but it is also to making sure that the young girl who are being ripped apart from the inside because she's been pregnant too young, or the woman who are now giving birth to 10 and 12 children and desperately need that access to service. She has a way to look into the future saying, these are not rights taken away from me, these are rights and access who will be increased going forward, so she can see a change.
Søren, a brief remark?
Yeah, just a brief remark on the rights. I completely agree. That is a strong position of Denmark and the Nordic countries traditionally, and it should be going forward to defend and protect the rights in the health field, not only sexual rights, reproductive rights and gender rights, but even more broadly health rights. And that will also stay priorities for the Nordic countries. I mean, knowing the politics of Denmark and the Nordic countries, I don't expect that to be as fragmented or politicized as in many other parts of the region. So even though right-wing, left-wing in Denmark, that's going to stay fairly constant. But one point is important. Going forward, it needs a new kind of leadership. It needs a new kind of diplomacy from Denmark and the Nordic countries. We cannot rely on the old ways of advancing or protecting these rights because they're increasingly challenged. So I would say that Denmark and other Nordic countries need to step up on the health diplomacy and also engaging pragmatically with many other stakeholders that we probably wouldn't just looking back a couple of years ago, would have interacted with. And we might also need to compromise a bit. And that takes very, very much diplomatic skill, but I think that's extremely important. What we see across many multilaterals is that even previously agreed language on sexual and reproductive health and rights is being challenged. So it's a very defensive position. But to be proactive, we have to engage in a new kind of diplomacy.
And at this time, I would just like briefly to introduce one of our guests here today, who is the Wandern ambassador for Denmark and the Nordic countries, Diane Gashumba. You are also a member of the Lancet Commission for Cancer. And I would like to ask you to just give a brief remark and ask you, as a previous also health minister of Rwanda and a representative from a country with a strong track record in health and a strong voice in the region, how you think a country like Denmark can play a role in positioning itself as a hub between North and South when it comes to global health.
Thank you very much. I want to commend the report and the expert who worked on this report, because it's a very nice report and very straightforward. I haven't received it when I received the invitation, and I started writing some bullets. But then when I received the report, everything was there, even beyond. And it resonates with the Africa strategy. Denmark has really launched very good strategy for Africa. The most important thing is implementation of all this. And in my view, implementation with Africa. Because, as you all know, one person out of 8 live in Africa now. By 2050, it's going to be 1 out of 4. And 11 out of 20 fastest growing economy are African. So nothing without Africa. And Denmark can really position itself to make things differently by shifting from aid to trading and looking at mutual beneficial partnerships. I want to talk about just one thing, how global health can progress. There is prevention first. Prevention in our countries in Africa requires just ownership of our leaders and our communities. And ownership doesn't need money. But then vaccines. Vaccines are provided by Gavi. It's not sustainable. I think we need to start manufacturing our vaccines, and that is what my country has done with the support of BioNTech. But Denmark is a global leader when it comes to manufacturing medicines and devices. Bring this manufacturing in Africa, get closer to the people, and the money is there, and the clients are in Africa. So I advocate for this. This is one thing Denmark can do. And the second thing is digitalization. You are really, really very far when it comes to digitalization. Bring this digitalization in Africa. And I want to give the example of SIDA. SIDA is Swedish International Development Aid. And Rwanda has benefited from SIDA support for the past 22 years. We trained 100 PhD holders with Sweden. We could have done more and much better by training them in Africa, where people are, and making these partnerships sustainable. Now SIDA has cut the budget and people are complaining. My Minister of Foreign Affairs told me when I announced to him that SIDA had cut the budget, he said it was overdue. It should have happened even before. I believe that we can do much better, and I rely on Denmark to make a difference. And I want also to talk about performance-based financing. Put your money, but tell people to be responsible and accountable for this money. And the only way is performance indicators. You give money, people perform. You give money, people perform, and you are accountable to taxpayers. Thank you.
Thank you so much, Mrs. Ambassador. So, some very interesting points about how global health is also about digitalization, it's about technology, it's about how we produce vaccines. Flemming, do you care to respond?
I will. First of all, I will say that Denmark is a very small country. Rwanda is a small country too. But now we are engaging much more. We are opening an embassy in Rwanda, and that will be good. Yes, of course, we have to to change experiences, and we have a lot to deliver to Rwanda and other African countries, and we will do that also through our strategy, both the African strategy but also the new development cooperation strategy, because we have to link those things. So yes, I really think implementation is also what it's all about when we have the political discussions, because we need success with the ODA from Denmark, and we really want to do it coordinated. So of course we have to put up KPIs together with the countries we are working together with, and this is really a cooperation. That's not as decades back. Now it's a cooperation where the dialogue is very, very intense to find out how to do it together. So thank you.
Søren, do you have a brief remark?
No, I agree completely with your remarks, and nothing without Africa. But also speaking to the vaccines, I mean, that is one of the very, very key lessons learned from the pandemic. The inequity of distribution of vaccines globally. And I think that still resonates very much. And as perhaps some in this room knows, I did play a role in ensuring that we had plenty of good vaccines in this country. And I had very mixed feelings about that, because that was my main job, was basically protecting my population. That was a national capacity, but of course also being very cognizant of the global responsibility we had. But we did not do well. I mean, the good vaccines, the safe and effective vaccines that quickly emerged with the messenger RNA, they were developed and produced in the European Union and North America, and most of them stayed there. It was also a question of timing. And when they were finally, we had ramped up production and we could distribute them globally, it was too late. I think that resonates extremely much. And of course, the solution is exactly what you're saying. We need to have research, development, production facilities, logistics on the African continent, but shared, of course, between North and South. And that is also happening now, so that investment is being made. And I think that's but I'm not sure we're doing it fast enough, though, because as highlighted by this expert panel, there's a 25% risk of a new pandemic in 10 years. That resonates with me. I mean, that's probably true. So we actually have a time factor here.
Thank you so much to the panel. And I know, Flemming, you have to run to the airport, so I will let you go. Thank you so much. And thanks for your remark. And we have another video greeting from Dr. Maria Mawit, who is the Maternal, Child and Adolescent Health Service Lead Executive Officer at the Ethiopian Ministry of Health, and talks on the need for stronger global health principles.
All protocols observed. Flemming Muller, Soren Bronston from WHO, Ole Thong from Ministry of Foreign Affairs. It's my pleasure to speak to an esteemed gathering of Danish and international health experts at the occasion of the launching of a new and exciting report. I thank the Danish Alliance for Global Health for their work and recommendation on how to strengthen Denmark's engagement in global health. Denmark and Ethiopia have a long-standing partnership dating back to the establishment of the first Danish embassy in our country in 1967. Our partnership with Denmark has focused on a range of critical issues of mutual importance, including poverty reduction, human rights, democracy, food security, WASH, and importantly, health. Sexual and reproductive health and rights have been a critical component of our partnership. As we look to the future, there are key areas where we seek collaboration to further advance our efforts in maternal and newborn health. These areas include expanding obstetric and newborn services to reach more communities, digitalizing policies for enhanced efficiency, and improving data quality and utilization for informed decision-making. I urge all of us to continue our unwavering commitment to improving maternal and newborn health in Ethiopia. Let us work together tirelessly to build a future where every mother and newborn has access to high-quality health care and the opportunity to thrive. Together we can make a difference and create a brighter and healthier future for all. I look forward to the outcome of the expert group work and hope the recommendations will create a positive momentum for even stronger Danish investment in health going forward. Thank you.
And for closing remarks, Ole, Chang, I have this for you. And Ole, you can stand there if you want to. Ole is it's another important partner in this whole debate because the Ministry of Foreign Affairs, of course, plays a big role. And Ole is the Deputy Director for Development Policy at the Danish Ministry of Foreign Affairs. So thank you.
Well, thank you so much. First thing I want to say is that I'm actually happy that Flemming left because he's my former boss, and he had many of the same points that I actually have written down as my closing remarks. And I don't know if it is what we used to write to him or if it's what he used to say to us we should mean about this that makes it coincide so much. In any case, first of all, thank you very much for inviting us and me to this gathering. I really also want to thank this alliance for taking the initiative and organizing this event. I want to thank the expert group for putting together all the recommendations that we now have. But actually, I'm most grateful for you shedding light on this topic because you don't hear much about it on the agenda, neither in Denmark or globally, at least not as much as you should, if I can put it that way. And all the things that Denmark collectively does out there in the world is not really reflected in many places, and there's been a tendency, I feel, recently to say, no, we need to move from aid to trade, and it doesn't work, and all of that. So I think actually, for me, that's the most important thing about having this event. So a huge thank you. I really mean that from my side. I want to focus on three issues. And you've been through it. As one of them, why is this important? Why do we need to talk more about global health needs? Secondly, what do we do from the side of Denmark? And thirdly, about how do we move forward on this agenda? And the first, why is this important? And I think, everybody in this room will agree that this is really a key factor. We need to focus more on global health issues, and including sexual and reproductive health and rights that you talked a lot about. It's the SDG 3, SDG 5, and all the SDGs are interlinked, and climate change make it all worse. And we all know the stories around it and why it is important. And then, of course, the pandemic, reminded everybody what can happen when things really go wrong. And I just came, actually this morning, landed from Uganda and Rwanda, where I had a lot of different diplomatic discussions. But what I noted was traveling around in the region, in all the airports, you had huge signs around Mpox, Marburg virus, and all of that. And I'm thinking, okay, if some of that comes to Europe, and the predictions Søren told about, that we have a 25% risk of having another pandemic within the next 10 years, I feel, we don't want to go through that again. And then you have also AMR, that my immediate former minister talked a lot about as also a huge risk. Again, AMR, an area where we have actually a huge amount of expertise in Denmark that we really try to bring out to the world. So my reflection around this is that, this is really important, but it's also kind of amazing how short collective memory the public has on these issues. Very, very fast we tend to forget what happened just a couple of years ago. And it's only when it hits us again everybody will wake up. So what do we do? It's so clear that there are so many priorities and so many global issues happening right now, and I feel it within foreign affairs. We have, the agenda inside our ministry these days is fairly full, if I can put it that way. I mean, we have the wars and conflicts, Ukraine, we have Gaza, and we forget about Sudan, which 20 years ago when we had a war there was top stories. With Darfur, we had all the Hollywood stars going there, etc., etc. It's not talked about even. And we have a much worse conflict in Sudan right now, including the health aspects of it is absolutely horrendous. And then the climate crisis, which is actually sliding down already now of our collective memory and agenda, even though, and I just came from Baku and hearing all the experts, it is worse than ever, and every time there's a new prediction or statement on how are we doing, we're doing worse than they feared last year. So that crisis is also there. We have economic, there are all these issues. Is there any room at all for talking about global health? Or maybe I should turn it around. In spite of all those challenges, we actually still do a lot on global health from the side of Denmark. You had the numbers from my former minister of 0.7. We tried to do a calculation, and this will just be rough estimates, but out of our close to 20 billion Danish kroners we have annually, we spend around 1.65 billion Danish kroners this year on health or maternal rights issues, which is somewhere around 5 to 7.5% of all our development assistance on health. That's actually a fair, quite a significant share of all we do. And then we did a calculation. So who is it actually we are supporting, and how do we do that? And I mean, when I got the list, I thought, okay, we are quite active, even though it's not talked about that much. We are supporting WHO, Global Fund, UNAIDS, UNFPA, Pandemic Fund, a lot of CSO, INGOs, MSI, reproductive, I can't even read what I've read, IPPF, Population Council, Amplified Change. We even have a bilateral program in Kenya that I know that very, very well because I worked with it for 7 years actually from Kenya. I visited hundreds of small health clinics in Kenya. We have an EU support. We support health through World Bank, etc., etc. So we are doing a lot, and we are doing a lot on health systems, which I firmly believe in. I mean, that's the foundation, and including around pandemics. If you don't have proper national health systems, you are in for bad days. We do in prevention, we do vaccines, we are working on infectious diseases, sexual reproductive health and rights, minorities, etc., etc. So I think we are out there, and we are really doing a lot from our side, even though it's not top of the agenda always. On moving forward, and I know part of the reason for doing this and doing it now is that we are just about to do a new strategy for development cooperation. And for me, this is really great input to it. But the fact of the matter is that we are just starting the process. So maybe your timing is actually really good because we haven't written it yet and we don't know what will be in it. So it's too early to say anything around how and what and how global health issues will be featured in the new strategy. But in any case, this is really good to have some external input. And again, as one of the panelists said, very concrete ideas and actions. What I also thought was important to mention in what we do in the future, recently we did a new strategy for life science, which I guess is just a fancy word for global health. But one of the points in that is actually to look at it not only from our development assistance side, but more broadly from what do we do from the side of Denmark at international level on these issues. And I think actually that resonates well with our current thinking also in the ministry, that we need to broaden our thinking beyond development assistance because we do also so many other things that can play together with our development assistance and create synergies and with so many also different Danish institutions. And also the private sector, because we have a very strong private sector on health in Denmark, or life science as they call them. And we have a very strong tradition in Denmark for working very close together between the public sector and the private sector, which oftentimes you don't have in many of the countries that we work in. So trying to bring private sector and public sector closer together in different forms of collaboration actually has a lot to it in many of the countries that I know of. And the private sector is important. Again, Mpox, if I remember correctly, Bavarian is only one of 2 companies at a global level that actually has a vaccine against Mpox, and actually something that we supported through our development assistance, where we gave, I think, 10 million Danish kroner to WHO, but to help rolling out the Mpox vaccine in the affected countries. We are also increasingly working with the other Danish ministries and Ministry of Health on what we term strategic sector corporations, which is another fancy word for saying that our Ministry of Health is working in other countries in the world and paid by development assistance to some extent, but that actually has proven as a really well functioning concept. And we want to do more of that. We want to expand that, and we also want to do that in African countries, actually. We're also working with Statens Serum Institute. I have no idea what that is in English, but I guess most of you know. They also have a lot of expertise, and there's a lot of opportunities also for us to work further together. And again, thinking a bit further, just the fact that we have Søren as one of the top advisors in WHO, for me, is also Denmark bringing something to the world. When our Minister of Health goes to the UN General Assembly and have global discussions on health issues, AMR, whatever it is, it's also Denmark bringing something to the world on this topic. So again, thinking of what can we as Denmark collectively deliver on this, for me, resonates very well with what we have to do more of moving forward. So for my closing remark will be that, despite we are moving into what we term, at least in foreign affairs, as a diplomatic super year. I think it's only us nerds who says that. Nobody else knows what it is, but we will be members of the UN Security Council next year, and also we will be president of the EU in second half of 2025. So there's a lot of opportunities for us actually to use those avenues to talk about health issues, and I'm sure with the elections in the US, maternal health will be also an issue that we need to discuss at a global level and see how do we go about that and what can we agree on, because we need to have a dialogue. Also, I can't remember which one of you said that, but I think that's actually really important. Moving forward, we need also to have a dialogue with those who do not entirely disagree or agree with us moving forward. But what I can promise, and again, thinking of the long list of partners that we support, is that we will continue to work on this issue. It is a priority for us. It might not be the top headline of everything we'll do in the next year, but we will be there. Thank you.
Can you hear me now? Yeah. To thank all the experts from the expert group, and to thank the speakers here today. And I think one of the points I take from you, Ole, is this is a very good time to launch this report and come up with these recommendations, because this is indeed, I mean, we have this convergence of all these important things happening where Denmark is developing a new strategy, is playing big roles in the EU, at the UN, and this is a time where we can put in the global health agenda. So it's not a coincidence that it is being launched right now. We have heard 19 very concrete recommendations from the expert group. We've heard that there is a strong momentum for Denmark right now. I am not an expert in global health, but from reading the report, from reading recommendations, from listening to the reflections and the discussions today, I think we can conclude that we know what works, that we know we can save lives, we know how to do it, and that the big question is what is needed to act on that knowledge. And this report and these recommendations is, like the experts have said, really a call to action to Denmark to seize the moment and the potential to become a global leader in strengthening global health at this time. Of course, the Alliance also hopes that all of you will take these recommendations with you. You now have them in your hands and use them in your work going forward the next months, the next years in global health, and share them so that they can live beyond this forum today. Very concrete, very tangible, policy-oriented recommendations. The full report is also available on the website and of the Alliance of Global Health, and you can find it by scanning the QR code that you also have if you need that. For those joining online, we want to thank you so much for tuning in. And for all of you here, you are welcome to continue the conversation. It was short. I think there are a lot of more to discuss, a lot of more questions. And we have a reception which will be held in the atrium downstairs. But just wait 1 minute. On the way down, if you are inspired by the poem by Tove Ditlevsen, there you can actually watch one of her manuscripts, I believe, on the way, which is exhibited here in the Black Diamond. And then I think I would like to end by calling the experts that we have, the 7 experts up here on stage. And thank you once again for your very hard work since August on these... Thank you so very much.
Thanks to the amazing secretariat that has been supporting us and working tirelessly to make it so
Thank you so much. And we can continue at the reception in the atrium downstairs.